everyone, so let's move towards our today's topic, which is
I will gonna tell you all the branches in a very easy manner so that you can easily memorize it, as well as it will be very after watching this lecture and after understanding this lecture, it will be very easy for you to memorize this, to memorize the whole course of the maxillary artery. So what is maxillary artery? First of all, you have to understand this. What happened basically, as you know, from left ventricle aorta arises, and aorta is supplying the whole body basically. Now as you know, from aorta on the left side, left common carotid artery arises, and on the right side, right common carotid artery will arise. But right common carotid artery will not arise directly from the aorta. It will arise from the brachiocephalic artery, which is the branch of aorta, whereas left common carotid artery will arise directly from the aorta. Okay, now these both are running on the left side, and the right side right side move करेगी और left side पर move कर रही होगी, अबव जा रही होंगी, ठीक है, ऊपर की तरफ हेड की तरफ वो आ रही होंगी, दोनों आर्टरीज रन कर रही होंगी. नाउ at the level of thyroid cartilage, as we have already talked about what is thyroid cartilage, you know, and we have already talked about in the lecture of larynx. So at the level of thyroid cartilage, these common carotid arteries, the left one as well as the right one, will divide and they will form external carotid artery as well as internal carotid artery. Okay, now external carotid artery will move further, and when it reaches posterior to the mandible, it will give the branch called as maxillary artery. Okay, so basically maxillary artery is the branch of external carotid artery. Okay, now what happened, maxillary artery will run on the mandible and the muscles around the mandible, and then it will enter into the skull. Okay, it will enter into the orbit, it will enter into the nasal cavity. Okay, that means it will supply the nose as well as orbit. It will also supply lower jaw, upper jaw, pharynx, and so on. Okay, but we will discuss in this lecture, and you have to remember those branches and those supplies, that which branch is supplying to which part. Okay, now before starting, you have to remember that maxillary artery is divided into three parts. The first part is mandibular part, the second part is muscular part, and the third part is pterygopalatine part. The mandibular part, like I said, external carotid artery will give the branch on the posterior side of the mandible. Okay, so from the posterior side of the mandible, basically if I tell you about that specifically, that basically जो neck of mandible होता है ना, उसके बिल्कुल posterior वहाँ से वो arise होती है, ठीक है, posterior to the neck of the mandible it will arise. So from that region, from that area till the lower border of the lateral pterygoid muscle, the lateral pterygoid muscle consists of two borders, upper border, lower border. So till the lower border, it is first part, that is mandibular part. From lower border to upper border, from lower border it will move upward, further upward till the upper border of the lateral pterygoid plate, and that is muscular part. And from the upper border of the lateral pterygoid muscle till the pterygopalatine fossa, the third part of the maxillary artery, it is called as third part of the maxillary artery, that is pterygopalatine part. Now what is pterygopalatine fossa? It is present, the fossa which is present below the apex of the orbit, it is called as pterygopalatine fossa. Okay, it is very simple. Now moving further, mandibular part. Now we have to remember the branches which are arising from these part of the maxillary artery. Mandibular part. Okay, now if the word auricle is coming in the artery, in the name of artery, it means it will supply the air. If the word orbit is coming, that means it will supply the orbital region. If the word tympanic is coming, is present in the name of any artery, that means it will supply the air. If there is a word meningeal in the name of any artery, that means it will enter into the cranial cavity, into cranial fossa. Okay, so if you remember these wordings, the name and the link of these name, you will easily memorize the branches. Okay, now mandibular mandibular part of the maxillary artery. The first part is called as mandibular part. So mandibular part will give 5 branches. Number 1, anterior tympanic artery. It will supply the external air. Deep auricular artery, it will supply the external air. Anterior tympanic artery, it will supply the middle air. Middle meningeal artery, it will enter into the middle cranial fossa through, you have to remember the foramen, so it will pass through foramen spinosum. The 4th branch is accessory meningeal artery. It will also enter into the cranial cavity through foramen ovale. Okay, and the last branch of mandibular part of maxillary artery is inferior alveolar artery. And alveolar, as the name indicate, it will supply the lower jaw. It will supply the jaw, and like the name is inferior alveolar artery, means कि ये lower jaw को supply करेंगे. तो lower jaw will supplied by inferior alveolar artery, which is the branch of mandibular part of the maxillary artery. Okay, now some points, like I said, डीप ऑरिकुलर आर्टरी किसको सप्लाई करेगी? एक्सटर्नल एयर को. एंटीरियर टिम्पैनिक आर्टरी मिडल एयर को. मिडल मेनिंजियल आर्टरी मिडल क्रेनियल फोसा में एंटर होगी थ्रू फोरामेन स्पाइनोसम. एसेसरी मेनिंजियल आर्टरी will enter into the cranial cavity through foramen ovale. Now you have to remember the course of the inferior alveolar artery. Like I said, it will supply the lower jaw. Now what happened? The branch will arise, okay, and they will that will pass through the mandibular foramen, as we have already talked about in the mandible bone, and in the lecture of the mandible bone I have told you that there is a foramen in the mandible bone that is called as mandibular foramen. So through that inferior alveolar artery, remember this point, that what are the contents of mandibular foramen? Inferior alveolar artery, inferior alveolar nerve, and inferior alveolar vein. Okay, so we are talking about inferior alveolar artery. So it will enter through the mandibular foramen. It will enter into the mandibular foramen, then it will run above the mylohyoid muscle, which is the muscle near the lower jaw. Okay, so you have to remember, and they will supply, and this artery, inferior alveolar artery, will supply the teeth of the lower jaw. Okay, now upper jaw. Upper jaw will supplied by it will supply by superior alveolar artery, which we will discuss after few minutes. But second part, now moving further, and that second part of the maxillary artery is called as muscular part. Okay, now it is very simple. It consists of 4 branches: mesenteric artery, deep temporal artery, pterygoid artery, and buccal artery. Mesenteric artery will supply mesenteric muscle. Deep temporal artery will supply the temporalis muscle. Pterygoid artery will supply to the pterygoid muscles, lateral and medial pterygoid muscles, and buccal artery will supply the skin of the cheeks. It's very simple, so you will easily memorize it. Now, many students will be confused in the third part of the maxillary artery, which is pterygopalatine part. So, it's very simple. You have to remember the name of the branch and the function, the supply, you will easily memorize it. The first branch is posterior superior alveolar artery. Now, like I told you that inferior alveolar artery is a branch of first part of the maxillary artery. Posterior superior alveolar artery is basically the branch of third part of the maxillary artery. Okay, so it will supply the anterior teeth of the upper jaw. What are the anterior teeth? Incisor teeth, canine teeth. Okay, so those teeth are supplied by this artery. If I talk about further second branch, infraorbital artery, it means that it will enter into the orbital region. How it will enter into the orbital region? It will enter into the orbital region through pterygomaxillary fissure. Then it enter into the orbit, and in the orbit it will enter. Basically what happened, infraorbital artery is arising from the third part of the maxillary artery. Then it will enter into orbit by passing through pterygomaxillary fissure as well as inferior orbital fissure. Okay, and after reaching the orbit, it will give some branches which will supply orbit, it will supply nose, then it will supply incisor and canine teeth as well, it will supply to lacrimal gland as well. Okay, now the third branch, greater palatine artery. Greater palatine artery will run in the greater palatine fossa. Okay, greater palatine canal, and then it enter into the nasal cavity by passing through the incisive canal. Incisive canal is present behind the incisive teeth. Okay, and during this whole course, like I said, greater palatine artery कहाँ move कर रही है, कहाँ मौजूद है? It is present in the greater palatine canal. तो greater palatine canal में वो मौजूद है, फिर वो nasal cavity में जाएगी through incisive canal, और इस दौरान इस movement इस पूरे course के दौरान ये supply करेगी palate को, it will supply nose, it will supply tonsils, it will supply gums as well. Now pharyngeal artery, as the name indicates, it will supply the pharynx, okay, as well as auditory tube. And the last branch is artery of pterygoid canal. As the name indicates, this artery will be present in the pterygoid canal, okay, and it will supply the pharynx as well as auditory tube. So basically pharyngeal artery as well as artery of the pterygoid canal, both will supply auditory tube, which is also known as eustachian tube, and as well as it will supply the pharynx. So this was the whole topic regarding maxillary artery. Till then, work hard, study hard, and take care. Bye bye.